The National Health Service used to be the ultimate sacred cow in British politics. Criticizing it was long considered a social taboo. But something has changed over the past 2 years or so. You can now quite regularly find articles in mainstream media publications which openly criticize the NHS and talk about better alternatives. The alternative they usually bring up is a European-type social health insurance system, or SHI. These are universal insurance systems where the role of the state is not to run healthcare facilities, but to ensure universal and equitable access to a largely private healthcare market. It's a good thing that the debate has shifted in that way, because as I show in my new IEA discussion paper, The Denationalisation of Healthcare, the critics of the NHS are right. SHI systems really do produce better healthcare outcomes and shorter waiting times than the NHS for a comparable cost. This is not just a case of the grass always looking greener on the other side. In this case, the grass really is greener. But the NHS's critics often struggle with two things. Firstly, they cannot tell us much about what their alternative would actually look like in practice. How would an SHI system adapted to the British context work? What would this mean for the individual patient? Secondly, they cannot tell us how we would get from where we are now to where they want to be. What would the transition from one system to another look like, and can this be done without too much disruption? This is a gap which my paper is trying to fill. I draw on the experience of countries which have transitioned from an NHS-type system to an SHI-type system in the past. This has been done before, and successfully so. I then use the experience of those countries to sketch out what such a transition away from the NHS could look like in this country.